Acute, or acute kidney injury, is a common and potentially life-threatening condition characterized by a sudden decline in kidney function. It is an important topic for medical students to understand, as it is encountered frequently in clinical practice. This script will provide a detailed overview of the pathophysiology, classification, diagnostic evaluation, causes, management, complications, and prevention of AKI. By the end of this script, you will have a comprehensive understanding of AKI and the current state of knowledge in this field. Acute kidney injury, AKI, can occur due to insults directly affecting the kidneys. Ischemia reperfusion injury, caused by reduced blood flow followed by restoration, leads to cellular damage. Reactive oxygen species, inflammation, and impaired metabolism further perpetuate kidney dysfunction by injuring renal tubular cells. In the video, we will discuss the classification and staging of acute kidney injury, AKI. We will explore two commonly used criteria: the rifle, risk, injury, failure, loss of kidney function, and end-stage kidney disease, and akin, acute kidney injury network, criteria. Both systems categorize AKI based on changes in serum creatinine levels, urine output, and the need for renal replacement therapy. These classification systems help clinicians assess and monitor the severity and progression of AKI, enhancing communication and decision-making in clinical practice. In the diagnostic evaluation of acute kidney injury, AKI, healthcare providers utilize various tests and imaging techniques to diagnose and determine the underlying cause. These may include measuring serum creatinine levels, analyzing urine, and conducting imaging studies like ultrasound or CT scans. Prerenal causes of AKI involve conditions that reduce blood flow to the kidneys, leading to dysfunction. These include hypovolemia, cardiogenic shock, sepsis, and renal artery stenosis, which decrease renal perfusion. Acute kidney injury, AKI, can be caused by various factors that directly affect the kidney tissue itself, such as acute tubular necrosis, ATN, glomerulonephritis, and acute interstitial nephritis. ATN is the most common cause, resulting from ischemic injury or exposure to nephrotoxic substances. Glomerulonephritis disrupts the filtration process, while acute interstitial nephritis can be caused by allergic reactions or infections. Postrenal causes of AKI include urinary stone obstruction, tumors in the urinary tract, and prostate enlargement. Prompt identification and treatment are crucial to prevent kidney damage. The management of AKI involves a multidisciplinary approach aimed at treating the underlying cause, supporting renal function, and preventing complications. Supportive measures, such as adequate hydration and correction of electrolyte imbalances, are essential. In cases of severe fluid loss, intravenous fluids may be administered to optimize intravascular volume. Electrolyte management, including the correction of imbalances such as hyperkalemia or metabolic acidosis, is crucial to prevent further complications. Hemodynamic optimization, achieved through maintaining adequate blood pressure and cardiac output, is also important for preserving renal perfusion. Renal replacement therapy, RRT, may be necessary in severe cases of AKI where conservative management fails to adequately support renal function. Various modalities of RRT, including intermittent hemodialysis, continuous renal replacement therapy, CRRT, and kidney transplantation, can be used depending on the patient's clinical status and the underlying cause of AKI. RRT provides vital support by removing waste products, regulating fluid and electrolyte balance, and controlling acid-base disturbances. However, it is not without complications, including hemodynamic instability, infections, and vascular access-related issues. Certain medications and toxins can damage the kidneys, leading to acute kidney injury, AKI. Common pain relievers called nonsteroidal anti-inflammatory drugs, NSAIDs, can cause AKI, especially in conditions where blood flow to the kidneys is reduced. Antibiotics like aminoglycosides or certain cephalosporins can also be toxic to the renal tubular cells, causing AKI. Contrast agents used in imaging studies can induce AKI, particularly in patients with existing kidney problems. Being aware of these risks and closely monitoring kidney function can help prevent drug-induced kidney injury. In this section of the video, we will explore how acute kidney injury, AKI, manifests and should be approached in critically ill patients, the elderly, pregnant women, and those with chronic kidney disease. By understanding the unique considerations for each population, we can improve diagnosis and management of AKI. The prognosis of AKI depends on several factors, including the underlying cause, severity, and timely management. Prompt recognition and treatment can improve outcomes and reduce the need for renal replacement therapy. However, there are factors, such as advanced age, comorbidities, or the presence of chronic kidney disease, that can increase the risk of complications and poor prognosis. AKI can also lead to long-term sequelae, including the development of chronic kidney disease and end-stage renal disease, underscoring the importance of long-term follow-up and management. Preventing ACI is vital to save lives and reduce healthcare burden. Strategies include optimizing fluid status, avoiding nephrotoxic meds, and managing comorbidities. Research focuses on biomarkers and targeted therapies for better outcomes. Understanding renal repair is crucial for interventions promoting recovery in ACI. In conclusion, acute kidney injury, AKI, is a complex condition characterized by sudden kidney function decline. It can be caused by various factors and is categorized by severity and progression. Diagnosis involves multiple tests and imaging. Management focuses on supportive measures, fluid resuscitation, and renal replacement therapy. Considerations include drug-induced injury, ACI in special populations, prognosis, and prevention strategies. A comprehensive understanding of ACI is crucial for optimal patient care.